Are you someone who's thinking about getting a facelift done? You may be in your 50s and 60s, your face is sagged, it doesn't look like what it used to. You've tried all non-surgical treatments, but they are not working anymore. You're thinking of a facelift, but you're worried what will the scar be like? Will that scar be very visible? To answer these questions, I'm Aniketh Venkataram at the Venkat Center for Aesthetic Health, Bangalore. So let us start by understanding what is a facelift. Well, it's kind of in the name. It's a surgery to lift the face. That's why it's called a facelift. In this surgery, basically what we're doing is we're making a cut and we're lifting up the skin so that all the skin that is sagging in the lower part of the face gets pulled up. That's a very simple explanation. Let us understand who is a good candidate for a facelift. Now, as we get older, there are a few different things which happen in the face. One, there is an effect of gravity. The face is, when we are young, our face is triangular like this. As we get older, it becomes more squarish because the face starts sagging down. We see these in the form of lines in this area, in the form of jowls in this area, and in the form of the neck getting very, very loose. So typically, when these changes have become more advanced, that is when a facelift is indicated. Typically, patients are in their 40s, 50s, or 60s. You might be asking, are there any non-surgical treatments for this instead of a facelift? There are. There are things such as threads. There are things such as skin tightening treatments, but these work only up to a certain point. Usually they work well in up to your 30s and maybe 40s. Beyond that, the facial sagging becomes so much that these non-surgical treatments simply aren't able to do enough anymore. They end up becoming a waste of your money. In patients like this, wherein the aging changes are very advanced and everything is very sagging down, facelift is the only thing that's going to give a real good noticeable difference. So how is a facelift done? Well, in this surgery, we analyze the patient. We see what all the patient needs. It involves the entire face. So we come from top to bottom. If needed, we lift the eyebrows up. If there is extra skin around the eyes, then we remove some skin around the eyes, what is called a blepharoplasty. If there is loss of fat in the face, we do fat grafting. We take fat from the stomach and we inject it. And then what is the actual quote-unquote facelift part of it? We make a cut at the edge of the hair and in the groove in front of the ear. This is for the face. If you also need to improve the neck, then the cut goes behind the ear and into your hairline before. So that is the neck lift. So this is the facelift and neck lift. So all this that I told you, eyebrows, eyelids, facelift, neck lift is done together as part of one surgical procedure. So we make this cut, we lift up the skin and then we tighten the tissues on the inside. There are various different ways to tighten this. We employ the technique that is required for that particular patient. We have studied in both Belgium and USA and we use different techniques for different patients based on what is required. So the tissues inside are tightened and then the skin is redraped, the extra skin is removed and then it is stitched up in a very, very fine manner. So this is the way the surgery is done. It's a very comprehensive method for restoring your face back to the way it was. Now you might be asking, doctor, is there any problems with this? Is there any complications that can happen with this surgery? This is a very, very safe surgery provided a surgeon knows what he is doing. If it's done in the right plane by the right surgeon, there is very little that can go wrong. There will be some swelling and some bruising, but that is part of normal recovery. Now coming to the actual surgery itself, how does it happen? This surgery is done under general anesthetic. Although sometimes if you're doing a limited facelift and you're only doing the face part, it's not very extensive, it can be done under local anesthesia also. Either way, you're admitted in the hospital for one night. So if you do the surgery today, you go home tomorrow. Soon after surgery, your face is going to be very, very swollen. It's going to look a little weird. It's going to be like one puffy balloon. That comes down very, very quickly. At the end of 1 week, most of the swelling has gone down and we start removing the stitches. All the stitches are out by around 10 days. Usually by around 2 weeks after the surgery, no one can make out that you have done anything. You have recovered. Now, although you might look swollen, physically you feel quite good within 2-3 days. You can work on a laptop, work from home within 3 days. For you to go out and show your face and people not to know that you've done something, usually that takes around 2 weeks, sometimes 3 weeks. The facelift results are seen immediately, it gets better and better, and the full result takes around 3 months. So, to summarize recovery, in terms of working from home, working on a laptop, 3 to 4 days. in terms of going out and people not knowing you've done something 2 to 3 weeks, in terms of having the full result 2 to 3 months. Now coming to the big question, how does the scar look? Is that scar very, very noticeable? In a short answer, the scars heal very, very well and it is very hard for anyone to make out. Don't take my word for it, here are some photos. So in this photo, you can see how it looks soon after surgery. This is where it is just healing, we have just removed the stitches. So you can make it out a little bit. Here you see another patient whose scar is almost a year after surgery. And you can see how faint it is. Basically, it heals so well that even at a very close conversational distance, it is very hard for someone to make out the scar. Yes, if someone knows you've had a facelift and they come right here and they search for it, then it's a tiny line they might be able to see. Now, let us see some examples of facelifts that we have done. So I hope this video was informative to you. At the Venkat Center, as I said, we look at the patient comprehensively and we do everything that is required for the face in one go. We don't stick by just any one technique. We use different techniques for different patients. In some patients, we do the max lift, which comes from Belgium. In other patients, we do a smastectomy, which comes from USA. We can even do a dual plane facelift. So every patient requires something different. Simply put, after a certain age, non-surgical treatments just don't cut it anymore and it's just a waste of money. If you've seen many celebrities, they go through this phase where they're looking very young. That's the time when they're using all non-surgical treatments and they're working well. And then they're into an awkward middle phase. This is where they need a facelift, but they're trying to avoid surgery and they try doing non-surgical treatments. So they do too much fillers and their face starts looking really plump and bloated. Then when they bite the bullet and they finally go for a proper surgical facelift, they again look very beautiful, very natural. Typically, they take a break for a year or so and then they come back and people are like, wow, she looks so good. What happened? The answer is a facelift. A well done facelift is something that makes you look 10-15 years younger and no one can make it out. So do your research, choose your doctor wisely. Thank you. Have a good day.